or in the abstract. Okay. Okay, so we made an Excel with title, author, university, years of defense, amongst others, for example, director thesis. Yes, we had a lot of information. Okay, you can see the Excel, for example, like I said, direction, who was in the tribunal. Yes, we can, here is Martin Mejias, the professor who is here, is the casual, but there are all the theses here. Okay, aims, type of study, the methodology that used for the doctoral thesis. And after that collection, we analyze and identify trends, distribution, key contributors, culminating in a preparation of a detailed report that discuss the observed trends, knowledge gaps, and implications for the field. Results. The SEO, when we use medical hydrology, the word of medical hydrology, we found 27 theses, okay? 20 of that established criteria for inclusion in the studio. So it's about hydrology medicine. Most of these theses are by women, okay? By women, and from Complutense of Madrid University. It's important to know that in Spain, the university who have a specific training in medicine thermal is Complutense de Madrid. Another 11 institution more. Okay, you can see here Complutense de Madrid, for example. It's important to remember that this is only from the word hydrology medicine, no Peloid, no, because are important university in another fields in specific that not appear here, okay? So, for example, from Complutense of Madrid, the Santiago de Compostela University, the university from Valencia, Valladolid, Granada, Salamanca, Cádiz, La Laguna University, okay? A diversity of doctoral programs were involved predominantly in the field of hydrology medicine, but for example, we found doctoral thesis in history, in architecture, yes. So it's important to imagine that hydrology medicine is an interdisciplinary field, yes. And we have to take that in mind all the time if we want future. Yes, if we want future. Okay, of course, hydrology, medical hydrology is the more important one program, and a lot of them are don't unidentified. Yes. In the most important year for publishment thesis, doctoral thesis, when was 2016. Yes, you could see that here. Yes, because changed the program of thesis. Me was one of them. I came from Argentina to Spain in 2008. Yes, to start my program of doctoral, and I have to finish in that year because was finished the program. So a lot of theses were there. Yes, you can see that. And the most of theses come from the Department of Physical Medicine and Rehabilitation, Medical Hydrology, indicating a strong concentration of research in this field. Yes. You can see here, yes, the Department of Complutense de Madrid, Physical Medicine and Rehabilitation, Medical Hydrology, architecture, history, science, yes, preventive medicine and public health, history of science, and a lot of them are unknown. That is a very important thing in hydrology medicine. We don't complete all the information. So when we looking for this type of details, we don't found because they are not completed. Okay, and this is who are the directors of director thesis. It's important to say that Complutense de Madrid is the more one who are the director of the thesis from Complutense de Madrid. Yes, you can see Professor Maraver. He's the father scientific of a lot of Spanish people. Yes. You can see the methodologies adopted by the thesis range from described and observational studio to randomized clinical trials, demonstrating a commitment to scientific rigor and in-depth exploration of various aspects of medical hydrology, including the efficacy of balneotherapy and the historical and qualitative analysis of related practice. Okay, you can see analysis of chemic, clinic research, bibliometric analysis, for example, and history analysis in Spain is a very important field up to maybe 70s. Yes. In conclusion, this survey revealed the richness and diversity of research in medical hydrology in Spain, highlighting the efficacy of balneotherapy for chronic conditions and the history and cultural value of this practice. However, significant challenges related to the incomplete of record in the SEO database were identified, which could cause underrepresentation of a study and the duplication of efforts. Interestingly, further analysis of the scientific productor portal of the University Complutense de Madrid show notable inconsistencies, such as researchers having 27 theses supervised registered on the portal, while only 10 appear in the SEO, highlighting disparities in the documentation of scientific outputs. This lack of uniformity points to the need for the reform in the registration system. A strategic measure to alter this scenario could be crucial not only in improving the integrity and accessibility of the database, but also in enhancing the international visibility of Spanish scientific research, attracting international collaboration and engaging the global impact of these investigations. Okay, thank you very much. I invite you, the university, to make a strong unit. We really have to work together. Yes, there are European funds for that. Yes, and we really have to be together for training medical hydrology in the future, and is very important, this field. Thank you very much.
I propose to have questions after each presentations because I think it is more closed. So we have questions after each presentation.
And I'll just say congratulations on the work and on the presentation. I think this type of project is very important to identify the landscape of the research that exists, to help also to put new researchers in touch with the right departments. And as we talk about a lot in this Congress, the future of analytics and data and AI, and the first step in that is having complete data sets to train. So this is a very important work for that. So I congratulate you for that. Are there any questions for the presenters or the authors?
There are some questions from our friend Schizo. Only to the microphone, please, because we have online participants, so we need to have sound.
Mine is to say congratulations and not to ask a question, but to quickly take advantage of your invitation to collaborate. We are ready. In my university, we've established the first center in the whole world for medical geology research. And the Senate of my university 3 months ago approved the 3 programs: postgraduate diploma, master's, and PhD in medical geology. And
I think it's quite a good achievement.
Yeah, and medical hydrology is a component of medical geology. In fact, we have up to medical hydrogeology as well. So I'll give you my card just now, immediately. Thank you.
Thank you very much.
I have also a question. I am very interested and curious in the meantime to know more about which kind of programs are dedicated to students for balneology in Complutense University.
Okay, there are 3 works in one of them is the answer of that, but okay. We teach in a physician degree, yes. We teach in occupational therapy degree, in a nutrition degree, in technology of aliment degree, and in a physiotherapy degree. Of course, we have a signature in a master and in PhD too. Yes, I will show you. But yes, we have a lot of teaching time.
Okay, so maybe we also can collaborate between universities.
Yes, I think it's really important. It's really important, and I think the future is only in the young people. Yes, and we have to have changes.
Okay.
Really.
So
And it's important. And in South America, yes, like Brazil, they are working in be disruptive in training medical. Yes, because the young people are learning different like us.
So only to tell you, I have about 150 students in the Romanian classes and about 50 students which are in the international program of University of Iași. So this is why I am also interested and to ask if in the Complutense University there are also, let's say, international programs, not only Spanish programs.
Yes, there are a very important international program. Yes, it's very important. Yes.
Thank you.
Yes, it's perhaps also more a comment. You mentioned the problem of finding those theses in other research disciplines. It has helped to publish quality criteria for research. I give you an example. I did for many years functional brain imaging, and once someone published a paper in which we published quality criteria, how to report a paper on functional brain imaging, like we had the point of reporting medication and so forth. And everyone cites in their thesis this paper. So this might be something helpful to push forward the field, because I'm convinced we don't find many theses in other countries, for example. So you mentioned the Pelowitz and so for example. And my question is, are there such quality criteria how to report research in medical hydrology?
Quality criteria. Okay. For example, we use if the thesis is for example a basis in research, clinical research, yes, is a good criteria. It's only observational study. It's not so good criteria. We think something like that, yes, but we have a lot of history thesis, a lot of, yes. In Spain was up to 50s, 60s, were very important history thesis, a lot of them, yes. Only the last years were in research.
One more question, and then, but to this, I also want to say we have an international society for medical hydrology. We have the best minds, and we could come together to create an international standard for just this such criteria. I think that would be helpful for up and coming researchers. So, sorry.
I approve of that, of course, and thank you for your presentation. Just to add to the discussion about the organization of the teaching of thermal medicine, as we call it in France. In France, we had 10 years ago only 5 to 7 students for the whole country. And these were in 4 different universities around France. And we combined things to create a college of thermal medicine teachers and made the teaching national. People are registered in one of these universities, but the teaching is made in common. And from this combination of forces, now we climbed up to 50 to 70 people each year entering the program. So I think really what you said, that combining forces is important, is really true. And but of course, it is even better if we can do it on an international basis. And so I think we should coordinate the professor interested in thermal medicine on an international basis instead of national, which will make things even better.
Yes, I think a very good idea. Really, maybe Professor Montañu could cut the cut. Yes, yes, yes. I think that is a very good idea. Thank you very much. Thank you.
Thank you so much.
Okay, so our next presentation, Lord Morel. Did I say it correctly, Morel or Morella? Yes, I don't know. I want to say it correctly. Anyway, the title is Aquapred Sodo Project: Control and Prevention Systems for Contaminants in Mineral Medicinal Waters Through Artificial Intelligence. So, I think so. Yes.
Hello?
No.
Hello?
Here, you take this. It's okay.
Hello. Thank you. Thank you very much for setting this presentation. This is something completely different, but it's a collaboration too. So in this field, we have many, many opportunities of collaboration. And this is an example. This is a project in the framework of Interreg Sudoe that is leading for the University of Vigo. You can see at the end, Dr. José Luis Legido. That is the IP of the project. Yeah. So the title, as you can see, is Control and Preventing System for Contaminants in Mineral and Medicinal Waters Through Artificial Intelligence. What happened here at the very beginning? During the last years in Spain and in other countries, doctors, medical hydrology doctors, and all the field is complaining because we have to chloride or bromide the water in the swimming pools, not in the private, we can say that, the other baths, no, but we have to chloride, we are obliged. So they said, and we agree because we are in the field of physics and chemical and we can prove that the water changes. and there are some changes in the chemical composition. So the aim at the very beginning was to know how much we have to treat the water, to chloride the water, without disturbing a lot or changing a lot the chemical composition. This was the first idea. We go ahead with that, and finally, we decided to collaborate with this university in La Coruña. They have this laboratory in artificial intelligence. The head of this group is very well known. Is the most seated in the research of artificial intelligence. So we decided to collaborate. And as you can see, is the Instituto Thermal of Dax, the University of Bordeaux. They are very skillful in this field too. Universidad Complutense de Madrid, of course. A research center in Portugal as well. Some associations, for example, Acqui Termes in Nouvelle-Aquitaine in France, Dax as well, and as associate to thermal spas. Because we are going, I am going to go ahead, but you are going to see that we are going to place, place a kind of pilots in each spa, and 6 thermal spas, to check the changes of the water when we add different systems to hygienize and so on. Yeah. And there is another part of the project that is we were talking about yesterday. Well, doesn't work. This one, oh, I think it doesn't work. Here, yeah. As you can see, this is you are talking about that. We have to collaborate. Yeah. So multi-territorial, multidisciplinary, because here we are. Artificial intelligence, physics, chemical, medicine, everything together, yeah? To monitorize and control the thermal mineral medicinal, we say in Spain, medicinal water. In another countries, in Portugal too, mineral medicinal water. I know that in another countries it's natural mineral water, but we use the term medicinal, that I think is important. Yeah, we use that. To predict the prediction of contaminants based on a digital of data in real time. That is, we are going to collect data at the very beginning to, how do you say, when you enter the data into a system? Yeah, to train the system, to detect the minerals and the changes of minerals and contaminants on real time in the spa. At the end of the project, each pilot should be ready to check this kind of contaminants. Well, the fluctuation of the contaminants and so on, this is important for the safety and quality of the water. We were working about that yesterday. I will try to explain briefly. When I started working with all together, in Portugal, there was a project that is called hydrogenome of the water. And they study the genome, I can say genome, yeah, thank you. The genome of every water, not only mineral waters, rivers, beaches, and so on. So we think, why not the mineral water? So we decided to add this part. It's an addition of the main project. And we say, okay, we're going to call that hydrobiome. Immediately, I went to PubMed, Finder, and so on, and I couldn't find any research, any paper about hydrobiome. So I decided, okay, I'm going to write about it. Sometimes I am a bit, how do you say, crazy. Sometimes I am a bit crazy. So I decided to go for that, and I wrote a paper, but related to my field, of course. Thermal spring waters as hydrobiome, thermal spring water as the base of cosmetics, because this is my field. But at least it's the first paper with the term hydrobiome. Since that, I am sure more and more investigations will be performed. So this is other part. We have already selected 6 thermal spas, and at this moment in Aquavalor in Portugal, they are filtering the water to extract the DNA and study the profile of the water, because we know it's not only problems. You know the problems with the bacteriological issue in thermal spas, but it's not only bad microorganisms. I say that they are not always bad. They are very good microorganisms that we are sure that they help in the treatment. In fact, there are very few studies about that in Australia. That is very strange. In Australia, they study the human microbiome, the skin microbiome, before entering into the swimming pool and after the mineral water swimming pool, of course, and after. So it's a new field. I think it will be the hot topic in the next years. I'm sure. So go ahead. We are going to develop an intelligent system. Yes, we are going to feed the system with a lot of information during the past years, all the composition of the waters along the years. Every spa is going to send this information, and then we are trying to predict the changes, and mainly, of course, if there is any kind of contamination. That is important. Here we can see, Annabelle, please. Sorry, because I need to, this is financed by SUDOE program, and I am obliged to spread this information and to communicate that, okay? So I need this slide to be show all the information. So here you can see all the partners. We have partners. This is that they have budget, an amount of money to work, and these associates, they only participate helping or in the field of communication, but they don't have any budget. Yeah. So we have the University of Vigo, that is the coordinator in Spain, Complutense de Madrid, Balneario El Raposo, yes, and University of La Coruña, that is the expert in artificial intelligence. These 2 thermal spas, Balneario El Raposo and Balneario El Cofrentes, and in France, the University of Po, and the University of Bordeaux with the Institute of Thermalism, and the Association Aquatherms. And in Portugal, Aquavalor, that is a new. They started about 4 or 5 years ago. It depends of Instituto Politécnico de Bragança, and they perform a lot of projects about thermal water. And with association, this is our government in Galicia, yes, and different thermal spas and associations. Here you can see all the logos and so on. Very briefly, the activities, as you know, in this kind of projects, we organize that in work package, more or less, yes. The first one is about improve the knowledge and use innovation to strengthen the thermal sector SUDOE. This is the typical, no, SUDOE. I think most of the participants know that, but it's an interreg collaborations between countries or among countries that are that have a border in common. France, Portugal, Spain, or it could be France with Germany and Belgium. Yeah, so, yeah, this kind of projects. This is in the south, so mainly this kind of countries. And at the beginning, we designed the data capture. We are developing the hydrobioma. We add this part as well. At the end of the project, we are going to study a system to save energy. You can say that. To save, yeah. To reduce energy and reuse as well. And in the work package 2, we are going to develop this monitoring system to measure the thermal water parameters, yeah. And we are going to deploy one pilot in each 6 thermal spas, okay? In this case, a real-time data capture and analysis will be performed. Always communication at the end, of course, that is important for Sudoe project. So the most important for us is improvement of health safety and increasing quality and confidence in the Sudoe thermal product. Customers or patients or clients, I don't know the name for the 3 of them, could check in real time what is happening with the water, the chemical parameters, the physical chemical parameters, the bacteriological profile, and so on, because we can have a kind of screen to check that. And this is important because it's after the COVID-19, we need people be sure that everything is right. And everything is safety, okay? So this one, please. So as I said before, this is financed by the Interreg Sudoe program. This is the name, you can check that. And well, I invite you to our university in Vigo, and of course, to collaborate. I think this is very important. The day before, I was astonished about your project of twin of our avatar. This is fantastic, fantastic project. 13, if I remember well, 13 countries collaborating. 9 countries, 15 partners, sorry. Amazing. So this is, for me and for our university, this is the way. Try to collaborate with countries. There are a lot of money in Europe for this kind of research. We have to do to make the most of it. So I invite you to our university and to collaborate in the future for this kind of projects. Thank you very much.
Thank you for a fantastic presentation. I think that this topic of, understanding the health of the water, just as we understand the health of the human, now we have a advanced understanding of the balance of microbiology of the system. And we look at this now for water. In my association in the United States, we hosted a call with a microbiologist earlier this year who made the case that for medicinal thermal waters, chlorination is the less preferred option from a safety and point of view, that in fact, a flow through of water maintains more the health of the water than the chlorine will, that even in fact, the chlorine is ineffective due to the pH of most of these waters. So it's a practice that is just for show, not for actual. So we have to have better data, and this is a wonderful step towards building those data sets. So thank you for that. And we open the floor to any questions for our colleague. We have one question in the back, maybe.
Please, if you can, my angels, help me. Thank you.
Thank you for,
Our angels, in fact, yeah, thank you.
yeah, they are our angels. Thank you, angels, for good job. I'm excited once more because I could flow very well with your presentation. In 2012, once more, which was a paper presented in Spain, I came up with a concept together with some guys in the computer science department. They were programmers of my university. And we began to develop AquaMed. Yeah, AquaMed, which is codenamed Balneology. So I think without wasting time, I will be the first to want to collaborate in this room. I don't know for others, but I'm excited and I would like to work with you to bring perfections to AquaMed, or if you like, Balneology. It is a software for analysis of water for balneological properties. Thank you.
You are welcome.
Okay, I have also a question. So the term hydrobiome, it is very exciting for me as I teach also microbiology for my students. So I learned something from these presentations, and I think it is a very wonderful concept you developed. I just checked on the internet if there are some more data about the hydrobiome, and I found true, I have to confirm, only one article, and it was your article.
Thank you. You are welcome. Not only in the field of, I think in the field of thermalism, this is very important. I am not a medical doctor, as you know. I am a doctor in physics, but I think you should study more the influence of hydrobioma in the treatment. It's not only chemical, it's not only physical, it's a
No,
complete.
many probiotics and something like that. And I think also it is important to have a look to the hydrobiome from the water we drink.
Yes.
So I think it is also very important
Yes.
in this manner. Mainly, we speak about crenotherapy. In Romania, I know that in French is a little bit a change of terms, but in Romania, crenotherapy means only to drink waters.
Yeah.
To drink waters for health. And when you drink waters, the water come with all the microorganisms in it,
Yes.
viruses, let's say, bacteria, and so on. So all of them are there.
Yeah.
And you have to know exactly many in this field. Also, the genetics is a quite important involvement, epigenetics, and so on. So there are many aspects which have to be investigated, researched in the future. So it will be a field, I think, an opening field from now on.
Next topic for the next Congress.
Yes, of
Thank you
course,
very
will
much.
be one of the. Thank you so much. Thank you so much.
Thank you. I believe that our next presentation is going to be a digital presentation. Is that right?
Yes, I will have to prepare a little bit. So if there are some comments, discussions, I will appreciate it. Thank
Okay.
you.
I can always talk. You know what this about me. So I will while Kitsu comes up, because my brother can also talk. We will say again, this hydrobiome idea is, I think, a fascinating one, and you know, we talk about the different aspects of balneological medicine, the thermal aspects, the physical aspects. Of course, we could argue thermal and physical is maybe a continuum. We talk about the mineral aspects, and now we can start to discuss the organic or microbiological aspects as well. So I do think it is a totally new frontier to open up for research for emerging scientists who are looking for a way to establish themselves within our growing field of balneotherapy. So that's my thought. I have No other thoughts unless somebody else wants to come and speak. And we have the digital presentation almost ready in a few seconds. I will start to announce the next session actually. The next presentation is called the Kovasna model, part of the European Balneology. So it's a presentation, again, it's going to be delivered through video, and our presenter, Michaela Carmen Susevianu. Okay. Susevianu. I'm learning. Okay. Anyway, without any further ado, I think we are almost ready for this presentation. So thank you. Wow.
Nu mă pot conecta.
Welcome.
Good morning. I cannot connect.
It is okay, we can see you.
Spuneți-mi cum să fac.
Okay, share screen.
Dar nu mi s-a făcut foarte mic aici și nu am vă rog frumos să mă ajutați. Cum să fac? Este imaginea, intru pe Zoom, nu reușesc.
Sunteți deja pe Zoom, noi vă vedem.
Dar nu pot eu, nu știu unde e share
screen.
screen.
Doar share screen este în bara jos a ecranului, acolo unde apare share.
Numai nu mi
pe Zoom.
Să intru pe Zoom.
Deci acolo unde sunteți pe...
Mă vedeți?
Vă vedem perfect și vă auzim.
Dar cum pot, nu, ce fac? Cum să dau să fie mai așa?
Ok.
Da, a apărut altceva.
Da, nu, deci trebuie să dați share screen și să selectați doar fișierul pe care vreți să-l prezentați.
Share.
Urmează, e ok, numai puțin, este perfect. Vă vedem și lucrarea.
Se vede lucrarea.
Full screen. Atât mai e de făcut. Apare de unde se dă full screen.
Și să dau full screen F5.
Exact. Oricum lucrarea se vede, vă vedem și pe dumneavoastră și vă auzim perfect.
Dar cum să facă? Nu.
Când este în bara de jos, o iconiță care dă de full screen. Dacă nu, sus...
O iconiță, numai care
e... Stați puțin, apare slideshow, pe bara de sus, după File, Home, Insert, Design, Transitions. Noi vă vedem ecranul acum și vă putem spune lucrul ăsta, deci slideshow apare sus. Nu merge.
Nu merge, nu?
Nu, slideshow. Trebuie să dați de sus, de pe bara de sus. Și start from beginning.
E share.
Este ok, deci la momentul ăsta noi vă vedem lucrarea, doar să o faceți full screen. Dacă nu, o să mergem în varianta asta, puteți derula slide cu slide.
E my screen, webinar, recording, view.
După animations vine slideshow.
Nu văd.
Sus apare File, Home, Insert, Design, Transitions, Animations and Slideshow. Eu vă văd ecranul acum și vă spun ce văd la dumneavoastră pe ecran.
Dumneavoastră nu puteți să-mi dați slideshow.
Nu, e dumneavoastră.
E audio, video, participant, chat, share.
Nu. Pe pagina pe care sunteți, pe documentul pe care sunteți,
sus.
File, Home, Insert, Design, Transitions, Animation, apare Slideshow.
Nu, dacă nu o să merg așa cu ea.
Ok, cum vă descurcați?
Acum nu văd eu ecranul, să dau în bară așa, da?
Da.
Da. Îmi cer scuze, I'm sorry, so I need more exercise to make such presentation. I wanted to be there, and but some problems in family make me to stay here. I'm very honored to be here with you to this prestigious international congress and to the anniversary of 125 years of Institute of Tekirdiyol. Many thanks to Professor Jello Onose for the opportunity to be here with you. I congratulate all the team because are very, very interesting things presented. I want to say that my presentation will be with the eyes of a cardiologist who is working from more 30 years in a health resort, and in the program of cardiac rehabilitation, we are using natural factors and so waters and gases and climate from a health resort well known in our country, which is called Covasna. We have nothing to disclosure. We know all that cardiac rehab is defined by the World Health Organization as the sum of activities and interventions required to ensure the best physical, mental, and social conditions possible so that patients with chronic or post-acute CVD may regain their proper place in the society and live an active life. Cardiac rehab is delivered through a program of prescribed exercise and interventions designed to modify coronary risk factors with the use of appropriate pharmacological therapy, non-pharmacological therapy, and lifestyle changes. Covasna model is addressed to cardiac rehab program for phase 2, phase 3 in a health resort with cardiovascular profile using natural factors such as climatotherapy, aerotherapy, the CO2 baths and mineral waters, mofetes, as well as non-pharmacological treatment added to the offer components of CR program. Covasna is situated in the heart of our country and is the health resort for hearts. Here are coming patients from all over the country for cardiac rehabilitation programs. Here you have an image of a hospital for cardiovascular rehabilitation from Covasna. But in Covasna we have this hospital for cardiac rehab, but also we have hotels with base of treatment where are coming also patients with the same profile. Covasna model is a non-pharmacological treatment which contains natural factors of Covasna, climatotherapy, aerotherapy, baths with mineral waters, which contain CO2, mofetes, dry baths with CO2, exercise training, counseling to change behaviors, tobacco use, obesity, sedentary diet, psychotherapy, diet, and also we use pharmacotherapy. Climatotherapy is a therapeutic method that makes use of natural environmental factors, namely the climate change, in order to maintain or ameliorate the organism's state of health. Covasna has a moderate climate of medium height mountains with sedative effects. Altitude 560, 600 meters, rich negative air ionization, resinous aerosols from the conifer forests. These are the surroundings, some images. In our hospital, we have from more of 40 years bioclimatological bulletins. So each day are analyzing the temperature, atmospheric pressure, humidity, and all natural factors. But so also mineral waters composition, mineralization, and the composition of Moffetta, what is the concentration at the level of foot or at the level of nose, and also some prognosis, what could happen in that days for patients and doctors. So maybe trouble of rhythms, maybe pains, and so on. But it's a tradition and it's very well documented by the physician of the hospital. Some images from the hospital, aerotherapy for children and also for adults, patients. About carbogaseous waters, best effects are obtained at concentration of 0.51 gram of CO2 per liter. The most important part in the balneary therapy of cardiovascular diseases, the cutaneous peripheral vasodilating effect brought about by the CO2, which is a resort in the tegument, acting as peripheral vasodilating medicine. This vasodilatation is obtained by the direct action of the resort CO2 on the muscle of the vascular walls. A secondary mechanism is obtained by the excitation of the cutaneous receptors, which is produced by the bubbles of CO2 laid in the thin layer on the skin. Another component is a thermic element. The effects of this process on the systemic circulation are the reduction of the peripheral resistance, which facilitates the heart activity, the increase of systolic flow and flow per minute as a result of cutaneous vasodilatation. Look the skin in the bath with mineral water or CO2. In the last analysis, the carbogaseous baths bring about by this hemodynamic modification an economical moderate training on the heart when the energetic metabolic stress of the organism does not increase. On the contrary, it even slightly lessens as a result of the reduction of the center temperature. At the same time, the carbogaseous baths also represent an exercise of adaptation of the system of neurovegetative and endocrine regulation to an adequate stress which combines the pharmacologic effect of CO2 with the thermoregulating circulatory stress. The increase of the venous return flow, the better vascularizing of the heart, along with concomitant reduction of the pulse frequency due to the induced hypothermia, are all favorable effects of the carbogaseous bath with various cardiovascular patients. Aspects from the bath of CO2, the Moffettes consists in the captation of the emanation of free gas, which contains 98% CO2 from the post-volcanic regions like Covasna and Harghita departments, and it is used as such for therapeutic purposes in room special equipped that allow the decline gas accumulation since it is heavier than air. They are like a Roman circle. Contains also sulfurous and small quantities of radon. Look the Moffetta of Hospital for Cardiology from outside, from inside. So this is the aspect of Moffetta with red sign where which is measuring the concentration of CO2. Look here are the patients, and from time to time, the concentration is evaluated with a flame. Here it's a natural Moffetta sulfatarium, and where the flame is stopped, it is a sign red put in the Moffetta. So the concentration of CO2 is different. At the level of food is 98%. At the level of red sign, it's about 12%. There were studies where was determined this, and at the level of nose is less than 2%. Here you see a traditional Moffetta, very old, more than 100 years, and with special infrared exposure. There are these lines with which show us different concentrations of CO2. Patients are evaluated by the specialists, and they recommend them after evaluation where to stay on which step. Moffetta bring vasodilating effects following the inhalation in the Moffetta, often air containing a high percentage of CO2, 1.5 to 2% volume CO2. The cerebral and muscular circulatory flow increases, which accounts for the favorable effects of the Moffetta in the atherosclerosis with arterial, peripheral, and cerebral localization with the peripheral ischemic syndrome. Here is a schema of the effect of CO2 from Moffetta, from the gaze. So about cutaneous level, it increases, Moffetta increases the cutaneous blood flow by arterial vasodilatation. CO2 penetrates the skin, direct action at the level of the meta-arterioles. On peripheral circulation, it increases the blood flow in the skeletal muscles through the arterial vasodilatation triggered by the CO2 dissolved in the plasma and reaching the level of the meta-arterioles in the skeletal muscle through inhalation. It lowers peripheral resistance. It lowers the minimum blood pressure. Hemodynamics of the heart, the decrease of the pre-ejection period, the increase of the ejection period, the lowering of the ratio pre-ejection period to ejection period, probably through vegetative changes. The increase of cardiac output, the increase of coronary perfusion. The concentration of the Moffetta, the gaze of Moffetta, is analyzed periodically by Institute of Balneology. Each Moffetta is analyzed and is evaluated the concentration of different components and also the concentration of CO2 at different levels. What I present before gives for us indication for cardiac rehabilitation program. So recommendations are for adults, ischemic heart disease after myocardial infarction, after bypass aortocoronarian, after PCI, heart transplant, chronic angina, before and after cardiac surgery, valvular correction of congenital heart diseases, heart failure, peripheral arterial disease, hypertension, high risk groups for CVD, metabolic syndrome, diabetes. We have also, we had, and now we have a section of cardiac rehabilitation for children. And there are also recommendations for cardiac rehabilitation in children children with congenital heart diseases, hypertension, obesity, trouble of peripheral circulation, cyanosis, Raynaud syndrome, valvulopathies, hyperkinetic syndrome, neurovegetative disorders, children who are coming from family with high risk for cardiovascular diseases, with hypertension, dyslipidemia, sudden death, or MI at early age. Among the specific procedures for cardiovascular rehabilitation, CO2 is applied as CO2 hydrotherapy and MOFETES, and represents a specific and unique model for cardiovascular rehabilitation. An exemplification of using in cardiovascular rehabilitation programs, the natural factors of Covasna, natural factor as basal CO2 and MOFETA is Covasna model applied in our hospital, which is a model of institutional prevention and rehabilitation program. We have 64 years of experience, aspects of the hospital. And here I mention once again, we applied non-pharmacological treatment, natural factors of Covasna, climatotherapy, baths with mineral waters, MOFETES, exercise training, counseling to change behaviors, physiotherapy, diet, pharmacotherapy, and this addressed to phase 2 and phase 3 for rehabilitation. Hospital for Cardiology, for cardiovascular rehabilitation, Dr. Benedek Gheza from Covasna has 700 beds, 11 sections for adults, and 1 section for children. And in a year, we have about 14,000 patients, inpatients for 16 days. Patients are coming from all over the country. For success of the program is a complex team which contains 25 cardiologists, 3 specialists in physical medicine and rehabilitation and balneology, cardiopediatrists, specialists in internal medicine, kinetotherapists, physiotherapists, endocrinologists, diabetologists, psychologists, nurses, and technicians. Patients are coming from all the departments of the country, from rural and urban area, you see here. And after the first diagnostic, this is a distribution. First of all, hypertension, then ischemic heart disease, surgery, peripheral artery disease. It is now a patient has not only one diagnosis, there are more associated. So the program is very well addressed to all of them. Patients after admission are evaluated. You see stress testing, echocardiography, Holter, EKG, and for blood pressure monitoring, Doppler peripheric. We have also CT, radiology, angiography. Then after evaluation, the patients have a personalized program for rehabilitation, which contains baths with mineral waters, MOFETA, air therapy, kinetotherapy, which could be in group or individual, different aspects from the room of gym. Also in COVID period, we had patients for cardiac rehabilitation programs, and also we have the room gym for children. In conclusion, among the specific procedures for cardiovascular rehabilitation, CO2 applied as CO2 hydrotherapy and MOFETES represents a specific and unique model for cardiovascular rehabilitation. Covasna model is a part of European Balneology. What I presented are arguments for this. For Romania, an important element must be added to the program of cardiac rehabilitation, natural factors offered by Romanian health resource that have a cardiovascular profile and use special natural factors. With increasing numbers of people living longer with symptomatic disease, the effectiveness and accessibility of secondary prevention and rehabilitation health services have never been more important. Rehabilitation is an important task in the management of cardiovascular diseases. The natural beauty and the resources such as mineral springs and MOFETES are the main reasons for choosing Covasna as the heart resort in Romania. Thank you very much. Grazie, gracias, obrigado. And I hope I could sustain by my presentation that the Covasna model is part of European balneology. Thank you so much, and excuse my technical abilities.
Thank you very much. Everything was okay. Now, if you can hear us, some
Yes.
discussions from the audience. There are some questions.
Yes.
I have to stress a little bit that yesterday we had the presentations from our Japanese colleagues. Shigeko Inokuma presented something about mineral waters with CO2. We have now to see the difference. This, I think, the MOFETES is the simplest kind of intervention. You have to do nothing, only to stay a little bit in the MOFETIC area, and I think the effects are very clear for the patients because they feel the temperature, how it is increasing. And what I want to point, and this is my question, is I know there are some references that the blood flow will increase with about 75% at the brain in the MOFETA treatment. I know only this, that these data are let's say, old data. I think these data are for about 40 years or something like that. So I want to know if there are other data which can, because we are in an evidence-based balneology, this is the logo and the motto of the Congress. So if we have some more data about this aspect, maybe because there are also many cardiologists in the hospital of Covasna, you can tell us more about the increasing in the blood flow after the treatment with MOFET.
Yes, in 71 was a great study between Institute of Balneology, Institute of Cardiology from Bucharest and our center, and also Institute from Târgu Mureș, but it was an investment in research. We are a normal hospital without funding for research. So there are, we need to do more. So to like at the level of our days, we have only our observations about the effects of MOFETA and the program, but we have no very well documented what happened. So at the same level, at that time they did evaluation with the radioisotope, I remember, and which shows the blood flow improving with 75% during Mofetta.
Yeah, I think it's quite a very
muscle
interesting
level.
aspect. Yeah, and I think also we need more data about the pharmacodynamic of this
Yes.
kind of resources. What I want to say one more thing is that the next Congress will be in Covasna, so maybe we can develop this idea to present, and maybe until then we'll have some more research data about this concept. And also I want to ask the audience if in other countries they know about Mofetta and they use it. I know in Hungary, for example, they use this kind of Mofetta, but artificial Mofetta, not natural Mofetta. So only chambers in which we can put also carbon dioxide, but not the natural kind of Mofetta. And this is the simplest and more effective kind of natural resource we can use. There are some interventions from audience. I see my colleagues, and you want to interfere. Only I ask my colleagues, our angels, to have a microphone.
Is it possible that a patient, cardiovascular patients inhales CO2 at the Mofetta?
Yes, yes. In some specific, here I will let my colleague, which is the doctor from Covasna, to intervene a little bit and to tell us, because the Covasna is known as the heart resort. So this, I think, is the field of my colleague, so I will let her to.
So do you want to repeat the question? So
the question is if the patients with cardiac problems can have this kind of treatment with Mofetta.
yes, I presented, maybe it was not very specific. So each patient is evaluated. If there are, they all are cardiovascular patients. They are in the evidence of a cardiologist in the town, in the residence place. And they are choose and for this type of treatment. But when they are coming in the hospital or in Covasna to our colleagues, each patient is evaluated. And if there are no heart failure, 3 degrees, 4 degrees, if there are no acute events, there are no trouble of rhythm, they are recommended to this program to have bath CO2 and Mofetta. The exposure is progressive from 3 minutes to 20 minutes. And the patient is evaluated each day, how is he, what happened, how which aspect has the ECG, the electrocardiogram, the blood pressure, if there are contraindications. So the patient must be in equilibrium. And very, very good Mofetta is for peripheral artery disease. We know many patients have this disease, and Mofetta helps very much to develop peripheral circulation very well, and it's recommended first of all to these patients, but all cardiovascular patients, if they have no contraindication, specific contraindication, are recommended to practice Mofetta.
And also I can add some more data. I know that there is a specific cardiovascular hospital, so there are many cardiologists which are working there. So all the problems related to cardiology, they involve with specific specialty doctors in cardiology. More than that, the Covasna is a cardiovascular rehabilitation resort. So it's specific for this kind of rehabilitation with rehabilitation. And also I want to add that prevention, prophylaxis is also another very important thing, because in a health resort, not only patients go there, also people which are maybe not, let's say, healthy, but for prevention, for prophylaxis is a very good place to go, because also the environment, there is forest near around the health resort, and the air is very fresh air, and very full of negative ions, which is also a quite an important factor. We have another question from my colleague Mihai, and I will ask my colleagues to give them. Yeah.
I have a
Sorry.
second question.
Please.
Who pays for the treatment in Romania for the cardiovascular treatment? The patients pays a part of the treatment, the state, the government?
I can answer directly because I know also the answer. The patients came with the insurance, and they are reimbursed for insurance if they come to the hospital. But also in Covasna, there are many other hotels, I think 10 or more hotels, which have their very good treatment basis. So they can pay for treatment, or they can have insurance, and persons retired, for example, they can go and have a reimbursement they have support from the government for these treatments. Okay, so my colleague Mihai, please.
Thank you for for the presentation, Dr. Suceveanu. My only a remark would be, we don't have the possibility maybe to do very specific scientific, let's say, experiments in order to reprove the effects of moffats and mineral waters. Maybe we will have the possibility, but for the moment it's not so easy to do it. But we can do other things that are handy. For example, the colleagues which work in balneology, but in the other field of rheumatology, made a meta-analysis which proved that some balneologic intervention reduce the consumption of anti-inflammatory and analgesic drugs. So if you have, like, the main patients, as I saw in the presentation, with arterial hypertension, then it would be a very easy study to see if your interventions at the cardiology hospital reduce the consumption of antihypertensive drugs or venotropes for peripheral venous disease or peripheral arterial disease. Let's say how these interventions really could stabilize the patient in a stage of disease without the necessity of further pharmacological treatment.
Yes, thank you very much.
Yes, we have had in the past studies with the colleagues cardiologists from the departments, which presented papers that patients who were treated in Covasna, who were to program here, used less medicines, and also they had less hospitalizations, hospitalizations, and their quality of life was better. And also, in my doctorate thesis was a role of our program on the cardiovascular risk factors, and I analyzed in time if the patients are coming at 6 months or 1 year. More times we had a success the level of LDL was lower than with the others, and they keep a good level of LDL. And also we analyze this hypertensive patients. One colleague did also, Dr. Arteza, and we looked to our patients and we saw the adherence of treatment, of changes of lifestyle is better, but all the parameters are better lowering if they are coming in Covasna 6 months and they are repeating the treatment compared with the patients who have the same lifestyle and if they take medicine home without coming in Covasna. So we observed good results in that field, and there were papers presented at different conferences, congresses on this field. And thank you so much. Maybe we have to have a better evidence of this.
I will stress also this need for research, and because you are online with us, and our colleague Julia Manolaki is with us, and is the representative of Covasna, I will stress a little bit about the need of research. Maybe until the next year, until the next Congress, we'll have something to prepare in this field. So maybe we can start to think to a project and to develop some experimental research for the next Congress, which will be in May in Covasna, like I said before. So we'll have some time to be prepared with some new data. And I know that is another question for the audience. Just a little bit, I have to say that I am not stressed by the time, because after this session is not a break. So we'll go further with the next session. And because we have time, I'm not stressed with this issue.
It's not a question. If you want proofs, I was treated at Dr. Manolaki resort, where she's a doctor. And I dropped my, in Nofeta, 2 weeks treatment. I dropped my blood pressure with more than 20 millimeters of mercury.
Yes.
Yes.
There are, we have here, you have the great specialist in Mofeta and CO2, Professor Montano and Professor Dogaru, which are very, very interested in CO2, mineral waters and Mofetas. So I'm very glad, so we, and my new colleagues from Covasna, and so it could be a team to develop more the field of research and observations if there are not enough funding for make more research. But maybe we could access a platform or something to do research at the level of our days.
Before the intervention of my brother Kitso, I want also to make a little comment, maybe a joke. Yeah, so many people who want more power, sexual power, have to come to Covasna because the effect of dilation is very strong. And when I speak about effects, this is another kind of effect which can be proved directly. Yes, natural Viagra. So I have to mention this because maybe it's important for us, many men next time. So my friend Kitso, please have the microphone.
Well, as far as I know in medicine, case control studies also provide evidence. And at this level, they have proven with this testimony that there is evidence at that level of case control studies. So more and more maybe analytical, clinical trials, etc., etc. But As a medical geologist, I'm very satisfied with their outcomes. Thank you.
Thank you very much.
Thank you very much.
And another question from the back. Very short, please. Yes.
Although we laugh a lot about this subject, it is not like that. When a man has this problem, he must sleep well, make sport,
And go to Kovasna.
and go to the internist first, because maybe serious internal problems, many internal problems, and in 10 years he can develop heart problems.
Yes,
But
true. I only want
to internist.
I only wanted to underline this aspect, which is quite important. For example, Sovata is also another resort for gynecological problem. And many couples which want to have children, they go to Sovata and have treatment. Also in Tehigel, there are also gynecologists. The mud has also these estrogen-like hormones and are very important. And before in vitro fertilization, Sovata, for example, I can give you the example of Sovata, is well known, and many couples come to Sovata to have after babies and so on. So many important aspects, and the sexual problems are also health problems and important problems. Only I wanted to take it like a joke to emphasize this aspect, but not take it only like a joke, but also as a scientific proof.
I believe the guide, which now is very good for all the practitioners, for family doctors, for specialists, is very good, because the patient to have success in our program is very important to choose for the present, for the patient, the right moment to be sent in a health resort. Because if they have contraindication for that moment, or if they have contraindication indication, for instance, cancers or something else, the program is not a success. So it's very well
to be careful and to take it medically, not like a joke. When I was telling this issue was like a joke, but you have to take it medically and to.
Yes, I understand, but I wanted.
There are contraindications, there are other medical issues, but take it like this. It is also a scientific issue which can be taken in account. So thank you very much. We close here this presentation. Thank you.
Thank you so much. Maybe for the next time I shall know where to insist and to present more concretely some of the aspect. Thank you so much. Thank you so much for question, for ability to have me on screen. Thank you.
Prepared. Oh, okay, is presented.
Thank you very much. Next presentation, Marcus Copley, American Paradigm in Health Resource Medicine, remaining in delivery method of balneotherapy.
Okay, maybe the microphone is yes, I think it gets a feedback. It says to leave webinar. I don't know if this is something I don't know to control, but it's not on the iPad, so I don't know. I can just talk though. It's okay. We can all look around that, pretend it's not there. Good to see you all again this morning. I will be speaking today about the concepts emerging paradigms for health resort medicine. So what do I mean by this? I mean, how do we consider the concept of health resort medicine and the administration of it? Okay, the beautiful bells of my presentation. Okay,
It is working?
no. Maybe
No, I have to go from this.
Ah. Okay, let's see. No, this doesn't work. Maybe this needs a new battery. I just do it from this. Okay, so the concepts for today. Whoop. Oh, fantastic! Even better. Okay, this is the structure of the presentation for today. I want to review the classic balneotherapy prescription as we understand it. I want to deconstruct the elements of a course of balneotherapy so we can understand what are the different aspects that are being applied. I want to review and expand these concepts that are inherent to the treatment. And I want to explore emerging healthcare paradigms as they relate to health resort medicine. This photo is from Murrieta Hot Springs Resort, where I'm the medical director. I hope we can invite you all to come and experience. It's in Southern California, close to Los Angeles, Disneyland, all this. In the United States, my position is titled medical director, which is maybe a little bit of a misnomer because I don't oversee patient care. But what I am working on is building programs for self-guided guest experiences that are science-informed, balneology-informed. And I think some of the elements of what I do will be apparent towards the end of this presentation. So the classic balneotherapy prescription, and I'm sure there will be some debate on what points I've included here, but I think more or less this is accurate. We do not have an agreed upon international standard for what a course of therapy is. It can differ site to site, country to country. Many variations will exist, like I said, between thermal centers and health resorts, as well as between countries. So what is actually considered one course of therapy is not standard. But we all lean on the classic empirically based 21-day cure. Now, it is becoming increasingly less popular with patients to stay at a health resort for 21 days due to economic reasons, work, etc. But most treatment courses that I have been exposed to tend towards some variation of this. 72 individual treatments for 20-minute immersions over a 21-day period. And we heard yesterday from our colleagues in France, they have a point system. One thermal 20-minute immersion would be 2 points. A kinetotherapy would be 1 point. So there are many different ways of constructing it, but consider this as an overarching idea of how we all are operating. Now, what are the elements that are consistent? Okay, we can take these individual elements into account, and it allows us to reconsider maybe for the 21st century what a balneotherapy course of treatment can look like and help us in investigating new frontiers of scientific investigation. So what I want to review are the concepts of time, the concepts of direct and reactive elements within the treatment, the concepts of amplification and conditioning across the treatments, and the concept of hormesis. So we'll start with time. And I think I start with time because for me, this is one element that I believe is very powerful for health resort medicine specifically, and maybe something that distinguishes health resort medicine from the practice of balneology, meaning you can have a balneology treatment, a one-off, but a health resort medicine implies an element of time. It's a course of treatment for a circumscribed duration, the health holiday, the cure, right? This is here in like Techie Girl, it's usually a 2-week period. And I think we can't overlook the importance of the psychosomatic effects of a patient being removed from their day-to-day experience and being in a consistent, focused intervention period and what that focused intervention period will do. So This is like I said, the limited longitudinal time, 10 to 21 days, is typical for resort-specific repeated interventions. And then there's also the individual timing component. So what time are they for their treatment? What time are they resting? How much sleep are they getting? When are they being fed? These components are going to create a rhythm to the therapy and to the patient. Within that, within those individual timed periods, we have direct and reactive effects of the different treatments, which we'll go into. And courses of treatment are programmed over the longitudinal length of the holiday or course of treatment or cure to maximize the amplification of the individual treatments and the conditioning for the full course of treatments. We'll explore this. So, what is the difference between a direct and reactive result? Many of us know this, but direct results are going to look at the biophysical effects that a particular treatment have. Whether that's a balneotherapy treatment or a physiotherapy treatment, there is a direct biophysical response that the treatment is imparting upon the patient. However, it doesn't end there. Now we have the response of the patient to the treatment, the reactive effect of the body. I think if we can start to look at these potentials and codify these, we can start to understand, the therapies a little bit deeper and talk about them with a little bit more sophistication. Reactive effects are considered the response of the patient's innate physiology. It's to the direct effect or the stimulation. So it's usually a means to try and maintain some homeostasis or thermoregulation, but it's this reactive response where a lot of the longer term effects of the treatment are maintained. And this has to do with these concepts of amplification and conditioning. So amplification is the simultaneous synergistic input of multiple treatments over the course of time and the enhancing effects that this has. When you pair a mud bath with a exercise in hot spring water, this has an amplifying effect on each of those individual effects. So it's the sum is more than the combination of the parts. The whole is more than the sum of the parts, so to speak. Conditioning is considered the physiologic adaptation to the entire course of treatment over time. The response of the body, how we, this is how we measure the health that has been imparted over the course of the treatment. So with health resort medicine, the frequency of a particular treatment, as well as the associated nutritional factors, rest and reactive periods, and the timing of the whole course of treatment, this should be considered not only for the individual influences on the treatments, but also for the interfacing and amplifying effects that each can have on the overall conditioned outcome. So you understand what I'm saying. We want to look at this as not just 1, 2, 3, but how this is creating the end effect over that course of time. And this brings us to the concept of hormesis. This is very essential within the world of balneotherapy and health resort medicine. Hormesis is the phenomenon whereby a toxic or inhibitory biophysiologic stressor, when it's presented in a lower or a subtoxic dose, it induces the stimulation, adaptive beneficial effects. So these adaptive stresses response will restore a higher order of homeostasis or increase the ability of the system to tolerate stress. So this is through, this is how we condition a higher ordered stress response in the system. And I think balneotherapy is an amazing hormetic therapy because of the heat, the thermal element, because of the pressure, the physical elements, and because of the mineral elements. Which actually, I want to ask a quick question of this room of the top minds in balneotherapy. And this is not meant to be so inflammatory, but just as a curiosity. The mineral component of balneotherapy, this is, part of the definition of balneotherapy is health through natural mineral waters, right? The study of natural mineral waters. How many in this room, with a just quick show of hands, understand through their read of the literature and experience that the mineral component of the water has a unique effect on the person experiencing it? Unique, separate from tap water. Yes, that there is a difference between a mineral in the water, that the mineral has an effect as compared to a non-mineral water. Yeah. But I don't think that this is all. Who here in the room believes maybe the minerals are not the effect, but maybe there is it is more the heat and the pressure, and the mineral is a bystander in this process. So we have some debate here, and I think that I'm not here to answer this question, but I think this is an interesting question for us to try as a society to better find an answer toward, because even amongst us, there is a little bit of a differentiating of opinion. So just a little bit of, morning tension to wake you up. But I think it's an interesting question, and I think it's an interesting point for us to look at. But I think we can all agree that the thermal effects and the physical effects are very strong, reproducible, and we can all be very clear about what's going on here. And understanding these effects, I think, also gives us some nuance into the therapies. We have the thermic reaction, the circulatory response, and the neurothermoregulatory response. So the heat, what it's doing physically, how that's affecting the circulation, and then the body's adaptation to regulate itself in response to this. These are the three elements of any thermal therapy, in my opinion. And this is, of a kind of a classic model for how we can categorize some of the temperatures to create reproducible effects within those categories. So it's a rational indication for therapy with expected outcomes regarding those, regarding these three categories. We can expect different reproducible effects within a range at these different temperature categories. That's another hot springs that I work for in Southern Colorado called the Pagosa Springs. So another point on your USA Balneo tour itinerary. Some of the concepts I talked about I discussed in a chapter I contributed to this, Essentials of Physical Medicine and Rehabilitation. It's a good undergraduate text on the concept of PRM and includes a lot on health resort concepts, balneotherapy. Many of our colleagues, even in this room, are represented here. And you can write to the author to receive a copy. It's a fantastic text on the review of the whole topic, I think is good. It just was second edition, just published this year. So I want to talk a little bit about a couple of emerging paradigms within medicine in general and how they may apply to our model of health resort medicine. The first is group healthcare visits. This is something that has become more popular within the last few years. One, for its cost-saving effects and de-stress on the practitioner, because you're able to see more patients in a shorter amount of time. But two, because there is a benefit of the community effect that the individual patients experience from being in a group and dealing with their medical condition. So it's a shared medical appointment, also known as a group visit, and it occurs when multiple patients are seen as a group for the follow-up care or the management of a chronic condition. Opportunities for implementation exist in the health resort setting. And I think it's maybe obvious because this sort of happens organically at the health resort, where patients are taking their treatments, they're congregating in the hallway, they meet for lunch. There are these group dynamics that naturally exist. So maybe perhaps with applying some of the concepts that are looked at in this group healthcare model, we can be more intentional about what is happening at the health resort and maybe leverage this to the advantage of the patient outcome. So I'll just, this is of PubMed code at the end for where I pulled this. Compared with individual care, group visits have the potential to improve patient experience, health outcomes, and costs for a diversity of health conditions. So although the findings varied between the studies that they were looking at in group healthcare visits, no adverse effects were associated with group healthcare delivery in these randomized trials. Group care models may contribute to the quality improvements, better health outcomes, and lower costs for select health conditions. So again, I think a model that applies very nicely to our field. The other concept I want to explore is something called narrative medicine or narrative-based medicine. It's the practice of medicine with skills of recognizing, absorbing, and interpreting the stories of illness. So to say it simply, it's how do we help our patients craft the story of their health and their illness and their return to health. It constitutes an approach to medicine that employs narrative skills to augment the scientific understanding of the illness. It's putting the patient back at the center. Who is the person who is experiencing this disease? How are they experiencing this? And what is their kind of global context for how their illness is affecting them? These insights can create a great context for patient-specific care. Narrative medicine, particularly in group settings, leverages the power of social connection for health with benefits of patient care and clinician wellness. So again, if we have groups telling the stories together, there's empowerment, and there's, especially when we think about lifestyle education within the health resort context, we now create an ability for deeper learning and encouragement and these type of factors. So Columbia University in New York is where a lot of this work has started. The founders of Columbia's narrative medicine program claim that to enter a narrative and have one's perspective of the world altered is at the heart of this practice. And I think there's something beautiful about, I think, we're all scientists and we all come to balneotherapy and balneology and health resort medicine from a medical point of view, but I think none of us can deny that there is a fantastical element to what we do. Also, there's the concepts of the fountain of youth and these almost journey-like experiences that someone must go through. They must leave their ordinary existence of day-to-day life, go to a health resort, experience a non-ordinary experience for a period of time, and return home. It's the classic hero's journey of psychological evolution. So how can we leverage this with the physical elements of what are going on to create very impactful and healing narratives for people? Thermal springs and the health resort, I think there is a great context for reframing people's narratives that's intrinsic to what we do. And I think if we enter it intentionally, maybe we can create even more profound impacts for physical health parameters as well as mental and spiritual. This is an example of some of the work that I've been creating. This is at Pagosa Hot Springs. This is me in the pool with 4 guests who are undergoing a group balneotherapy session. On the left, we have kind of a self-guided plan for guests to be able to utilize the springs. We have 25 different pools and we keep them at different temperatures, and the temperatures are all listed. And we give guests a guide for how to utilize the different waters, go through contrast therapy, et cetera. And we have different educational pieces kind of throughout the spring so that we can kind of encourage self-use and self-care. What I'm doing here, I have 4 guests. They all have a different medical background. One of the women is type 2 diabetic with a family history of amputation due to diabetes. One of the women was chronic stress to the point of absolute dysregulation of her hormonal system. One woman had gone through an extreme grief with the loss of 2 family members. One woman had long COVID and medical trauma from ventilator treatment for COVID. So why do I bring up that? Is because each one of them had a different story, but we were all together in one pool, experiencing the same biophysical effects and learning about how these effects will create change in our body and empowering each other. Even though they had different conditions, we were all able to use this non-specific therapy to enhance our health as a group. So there was a lot. It was a very powerful day and a great proof of concept for me. And I hope to do more things like this in the future. So final thought. Of course, I'm the president for Balneology Association of North America, and we are trying within the next year to publish our first journal, and it will be the first balneotherapy-based journal from North America in over 100 years. Of course, we don't have much evidence or science being produced within America, so I make a call to my international colleagues to help us by submitting some papers for publication. So the publication will be set for 2025. The journal is called the International Journal for Balneology and Health Resort Medicine. And if you look at healthresortmedicine.com, the submission, the author guidelines are not up yet, but how to submit paper and all that is all on the website, and the author guidelines will be up soon. So this is all I have for today. Thank you for an amazing Congress, and thank you for allowing me to share a little bit about the things that rattle around in my head when I think about balneology. Thank you.
Dear Marcus, I think you cannot escape from the discussions because there are so many aspects I wanted also to point. You have a wonderful presentation. Thank you so much. It was kind of plenary lecture, a very good plenary lecture. You stressed so many points. Time, you started with the time, which is quite an important aspect in balneology, because the time of the cure is quite an important aspect. For example, in this way, I have to point that after a few days of balneary treatment is the balneary crisis. And if you have a very short treatment time, is nothing to obtain, because only to obtain is to challenge the organism, to have the stress, and nothing more. We have only the balneary crisis. This is why we have to the treatment have to be longer, at least 10 days, something like that. Otherwise, we have opposite effects. Related to the discussion with the chemical content of waters, here I have some very important points related to the content, the chemical content. For example, if we speak about sulfurous waters, the chemical composition is very important in this aspect. And I give only 3 kinds of waters in which the chemical content is important, and we have to mention this. Otherwise, we speak about in Romania. I don't know. I know that there are different terms, but in Romania, otherwise we speak about hydrotherapy, not about balneotherapy. We have very clear this distinction between hydrotherapy and balneotherapy. And in balneotherapy, we use only mineral natural therapeutic waters. And the 3 main kind of waters can be pointed as with importance of their chemical content are the sulfurous waters. Here is no doubt that there are many evidences. The carbonated mineral waters with carbon dioxide. We see and we know very well the importance of carbon dioxide, which can also pass the barrier, the skin barrier. And very salty waters, for an example, for Sovata, when we speak about the water with 300 grams of salt, the chemical content cannot be eluded. It is to be there. So it is an important aspect, but to be taken in account. So the chemical composition is very important. It's not a lesser, let's say, aspect of the natural therapeutic factor.
I completely agree with you. However, I will also note that for the first 2 examples that you mentioned, I think the argument, maybe even our Spanish colleagues would agree with, based on some of the presentations, the argument is there's a more gas effects than mineral effect. So
yeah, so the chemical composition, let's say,
yes.
it is a
Yes, totally. But I do think it is an interesting question for the group about the specific about the physical mineral as well as the rest of the chemical, of course. But anyway, yeah, I appreciate your point.
Yeah, so the audience also, I think, can agree with me related to this aspect of the chemical content of the waters. So there are some many important, and also was a very important aspect when we speak about narrative medicine or narrative. We have anamnesis. Each balneary treatment starts with the anamnesis of the patient, and it is quite an important. Without this first step of the balneary treatment, I cannot think to have the further steps of the balneary treatment. So also anamnesis have to be included in the balneary aspect, in the balneary let's say cure. Yeah, so many aspects I saw in your presentation. I like it very much, and I congratulate you for this presentation. Thank you. Professor Onose, if you want to say something. I think from the discussion, you already take the point, so.
Yeah. Thank you for the presentation. I want to stress several points. First of all, always there is a chance for somebody or an institution that starts a little bit later, but benefits from the experience of other, including not very satisfying one. So I should advise you, and probably this is very possible in United States and in North America, because you have never been, fortunately, communist countries. And I know very well what I'm saying. God bless. And we inherit some kind of institutional empowerment that has been also continued, including in democracy. And one of the hurdles is that since before the revolution, the ex-leader considered, from different reasons, it's not the time and the place to develop them, to give the senatorial cure institutions from the Ministry of Health to the Ministry of Tourism. This was a fatal mistake. And from the first top countries with health tourist destination, we have submitted a drop, because the K word regarding the beneficials is not neither patient, because they are not very severe patients, nor simple tourists. They are curants. So people with some health problem, but not very severe, and yet also with the appetite for some facilities of culture and tourist kind. But on the first place is the health. And we had a lot of tour operators that, after this stupid measure of the dictator, asked through the embassies what happens, because we try to contact health institutions and we got answers from tourists, which is not convincing. Parenthesis, this was the successful way of conquering, including the North American market, with our well-known biogerotrophics, Gerovital and Aslavital, by our distinguished Professor Anna Aslan, who knew to make the perfect balance between science and accessibility in her conference. But she was a very well-known doctor, not a tourist operator. Well, what I say, fortunately in the United States and North America, you will not have to address too much the tourists, because this induces a problem. And I want to also to say that you have spoken in your introduction word 2 days ago that you had some tradition and then you had a drop, and I remember very well, and I always wondering, a country like a continent, like two continents, United States and Canada, with so many natural resources, how is it not on top of this? And I remember that President George W. Bush said in a little movie, what do you are you waiting for? To ask to come here in the United States for including the balneal treatment. And I think that a kind of compensation was the very successful many sessions movie, Dr. Queen, which was speaking about Colorado Springs and their wonderful facilities and health results. And I will end about the narrative. Well, narrative is a nomination. We are facing with it because we write a lot. There is a difference if you make a systematic literature review, and that means to follow a standardized method, or a narrative review. This is also a nuance. So good luck, and hopefully as soon as possible to have a World Congress in the United States. Thank you.
And related to the publication, I'm very, let's say, I express my desire to collaborate between the Balneo Research Journal and the new publication. Maybe we can have some contacts and can develop together some editorial project.
Absolutely,
Thank
absolutely.
you.
Okay, just a comment. I born in Argentina. I work there with original population, yes, like Mapuches, Quechuas. And when I ask them why 21 days, why you use the math 21 days, because there are 21 days with moon. Without moon, we don't use the math. Okay, something curious.
Interesting, yeah.
Regarding the tourist interference, Constantine was saying that between the 5th and the 6th day of balnear treatment, there is a balnear crisis. And there is a second one.
Just a little open the microphone. Thank you.
It's open.
Okay.
And there is another smaller one between the 10th and 11th day. So balnear treatment has to overpower this period. But the different tourist structures want to make it smaller because we have to comply with the different preferences of the person. They don't have but 5 or 6 days free. So let's make it also for 5 days.
In 5 days, we cannot obtain effects.
From their point of view, it's understandable. They have they don't have currents, they have clients.
I would say a quick response to this is the concept of crisis is a very important one that we could work to develop more. Very well should have been in this presentation, in fact, because now we start to think the elements that I talked about, amplification, conditioning, timing. Can we maybe investigate, is it necessary to do 21 days, 11 days to find these crisis moments? Can we find crisis moments by restructuring the intensity of treatments for shorter periods of time? You know, I don't have the answers to this, but I think
there are some articles related to the stress, and we have the metabolic. We have some data, and we correlate with more we know from the databases we have in our past history. So we know for sure that in some days after starting the treatment, we'll have the balneary crisis.
My question would be, though, if you maybe do twice as many treatments in half as much time, will you create the same? That's the basic segment of this.
We don't know everything,
Yes,
so we
yes.
have to research a lot. Yeah.
That's the essence of my conversation here, is if we can deconstruct, can we reorganize and have the same effects? I don't know. Anyway.
Yeah, please.
Very briefly, thank you very much for the presentation. And I would like to highlight the concept of hormesis, because sometimes we forgot that.
Marcus.
And here I have a publication, a paper from Dr. Ortega that works with us he works in the University of Extremadura. Balneotherapy, immune system and stress response, hormetic strategy.
It's a fascinating
Yes.
paper I cite all the time. Yeah.
Yeah, and Dr. Masiero from Italy also follows the theory. So thank you very much for highlighting that. And I think it's another way of investigation.
Yeah, there was so many questions in my mind. This was another point, but if you start this discussion with so many points, I think we cannot end the Congress today.
I've never been
If we want to end the Congress today, we have to discuss only to see all the aspects. So this is why I say that this was a perfect plenary lecture.
Great.
Yeah.
I've never been accused of being too focused, so.
Yeah.
Yeah. I think the Kitso, and then maybe I think we wrap, yeah.
Well, is to stress the strategic importance of the journal you are trying to float. This is the best way for me to propagate the science. And it's a beautiful addition to journals that we already have, such as the one Montino has excellently projected. We need more platforms to dish out our research activities, products, and results or outcomes to society, to policymakers, to academics, and of course, to use our research outcomes to recruit new members. Yesterday, Professor Inokuma was quite delighted seeing young people in this Congress. And young people means future for the society. To recruit future researchers, we need robust journals. And so I'm glad, and I want to assure that together we will develop more of such platforms. In concept at the moment, we're also thinking of the first international journal for medical geology research.
So in this case, I have a proposal for each of you.
Yes.
I propose the Federation of Editors in Balneology.
Okay.
So maybe in this way, we can create something which is quite important. So let's make the Federation of Editors in Balneology, or this is the name can be changed in this way, and try to collaborate together. And I think you pointed very well. We need more platforms in which our research to be published, to be developed. And in this way, I think we can have a common sharing.
Yes.
So I propose this to have the Federation of the Balneological Editors or something like that. The title can be changed, and we can discuss after and have it by email, of course, and to have from United States of America, from Nigeria, from Spain, and from other countries, from Italy, of course, and we can join this kind of initiative. I think also Professor Antonella Fioravanti is here, so also can come in this. Yes, of course. And in Japan, I think also there is a journal, so we can make it internationally, and we have more power when we are together.
Yes.
Singularity can be developed. You can develop by yourselves, but when you are we are together in a collaborative project like this, I think we can have more and stronger power.
Totally agree.
Only to the microphone, please, because there are many colleagues with us online, so please.
Thank you, Constantine. I think this is a good idea. And we have to work together and publish in your journal, in this possible journal, to increase our impact factor and to increase our level in Shimago website, not to increase from Q3 to Q2 to then we have to.
So I see this like an international database for like Crossref, PubMed, and so on. So like an international database for balneotherapy, I think will be a very good platform for each of us to make further development for this field.
I agree. Thank you.
Thank you.
Very happy.
It was a spontaneous idea, so it is not something, it was coming when I
It's called
started.
inspiration. Okay, we take these moments.
Brainstorming, something like that.
Yes, fantastic. Thank you, everybody.
Yeah, so if there are no more comments and questions, we'll start the next section without break because we are in the last day of the Congress. Thank you so much. So my angels, please take in account to change everything. Thank you. Mulțumesc mult de tot.